Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now tonight on the show we are delighted to welcome Dr Sarthak. He is the Chief Executive Officer at Asia Pacific Leaders Malaria Alliance, which is a coalition of government representatives from 22 countries in the Asia Pacific, all committed to eliminating malaria by 2030. He joins us tonight from Singapore to discuss the recently launched World Malaria Report for 2020, which looks at the progress made in the fight against malaria, which is a preventable and treatable disease that continues to claim hundreds of thousands of lives each year. Good evening, Dr. Das, or Dr. Sartak, if I may. Now, the report showed progress made against malaria, specifically in Asia Pacific. And I also want to focus in on Southeast Asia, which is on track to achieve a 40% reduction in malaria cases this year. Maybe you can begin by talking a little bit about malaria in Malaysia and our progress towards malaria elimination targets.
Yeah, thank you. And thanks for having me on your program. Back in 2016, the World Health Organization identified 21 countries, and of those to target elimination of malaria by 2020. And Malaysia achieved that target 2 years ahead of schedule in 2018, with the prospect of being certified as a country that has eliminated malaria in the coming year. So Malaysia has made remarkable progress doing bread and butter work, the important work of detection, diagnosis, and surveillance to remove this scourge from the country. And that's incredibly impressive. We have a few other countries in our region, Timor-Leste being one, Sri Lanka, which has eliminated, China, which is on the cusp. And we've seen a 90% reduction in cases since 2000 in the greater Mekong sub-region. So that's the good news story of parts of Asia Pacific. There is still a lot of work to be done. And there are countries such as Papua New Guinea, parts of Indonesia, and India, which remain with a high burden of indigenous cases of malaria.
Sartak, if you could help us understand, what exactly we're talking about. Malaria is a disease, I believe it's caused by a parasite carried by a mosquito, the vector. So when we talk about the elimination of malaria, what point of this process are we talking about in terms of getting rid of this whole complex of processes and transmissions?
So what you're talking about with elimination is zero indigenous cases, meaning no local transmission of the malaria parasite within the borders of a country. But as you know, mosquitoes don't apply for visas, they don't carry passports, and imported malaria remains a threat for Malaysia, it remains a threat for Sri Lanka, and any country which has eliminated in a context where you still have high regions of endemicity.
That's quite interesting. I was wondering whether you could also give us a sense of, not just elimination of the disease, but also prevention of the disease. So what goes into preventing malaria?
So in terms of prevention of malaria, what we need to first understand is what the parasite is using as its host, meaning the mosquito, what the behaviors are of the mosquito, and what are the remedies that can be used to prevent that behavior, meaning the behavior that's facilitating transmission of malaria. And that could be as straightforward as the distribution of insecticide-treated nets. It could involve indoor spraying. It could involve outdoor spraying and basic public health measures just in terms of not keeping pools of water around. And those are the things that largely need to happen at a community level obviously at a household level. And with malaria, at this point in our region, what we are talking is a disease that is predominantly among migrant populations, vulnerable populations, rural populations, and largely the poor. So we're talking about something that really disproportionately affects the disenfranchised. But in our region, it's happening at, relatively speaking, in smaller numbers and in more remote areas, which makes the challenge of getting to elimination, and in some cases even to control, all the more difficult.
Sartak, you know, malaria is such an old disease, isn't it? I mean, it's a disease that's been with us for millennia, that's in fact, in some human populations, changed their genetic or physical makeup. I think sickle cell anemia is a consequence of malaria. Could you help us understand, how is it that we've lived with this disease for so long, and yet we don't have, in some sense, an effective prophylaxis, or we don't have a vaccine, to use the word that's on the lips of everybody today?
Yeah. Well, it's tremendously complex, as you can imagine, because what we're talking about is trying to develop the process of trying to develop a vaccine for malaria has been going on for a long time. And we know that there are so many stages involved in terms of the parasite, its relationship to the host, the stages at which it moves through once it enters into a human body. I won't go into all the details around that. Suffice to say that it presents a number of challenges that are much more complex than, let's say, the kind of challenge that faced us with the development of the vaccine for SARS-CoV-2. Now, having said that, I think that we have seen in terms of what happened with the development of the COVID vaccine, which I think we should also all remain still cautiously optimistic, because we don't know some things about the length of the protective effect, what it means in terms of being able to transmit to those who have not been vaccinated. But having said all of that, what we know from studying the history of vaccine development is that it is in no way an exaggeration to say that this is an unprecedented historic event to achieve the development of vaccines in such a short time. So I think that gives hope for us to galvanize support and really think, yes, this is a challenge that we may yet be able to tackle with the sufficient investment, political will, and persistence in terms of the development of a malaria vaccine. Because as you rightly pointed out, malaria over the last thousands of years has claimed more lives than probably any infectious threat we've had.
So those challenges that you highlighted, Sartak, investment, political will, talk to us about those challenges. How significant are they in malaria elimination? Because I'm wondering whether there is political will, especially as the WHO raised some concerns this year that there's been a plateau in progress in the fight against malaria. How significant are those challenges that you raised when it comes to the fight against malaria?
They're tremendous challenges in terms of political will, particularly in Asia Pacific. But I do think our colleagues and those who are invested in this work in sub-Saharan Africa, where almost 90% of the global burden of nearly 500,000 cases rests, 500,000 deaths rather. But I think that the thing that we need to keep in mind in terms of not allowing malaria to fall off the consciousness of political leaders is recognizing, one, that this is something that can be done. Much of the world has achieved it. As we talked about in the beginning, Malaysia is on the cusp. Sri Lanka, other countries in the region have done it, to say nothing of the North American continent and Europe. So it can be done. And we need to remind everybody about that. And the second piece I want to say is that there's three things I want to say. The second thing I want to say is that in doing it, we are going to free up resources to tackle other intractable health issues, because right now it has a tremendous impact, not just on lives, but also economic output. And the third piece is that these are investments that we make in the health system that prepare us to be able to tackle future threats. But in terms of public health preparedness.
Sartak, the fact that, you know, the burden, as you put it, is disproportionate among the poorest of nations in the world, is that a reason why we haven't moved so far? I mean, is it because poor people are dying and not rich people from the affluent West? And I know you've been faced, I'm sure you've been faced with this question before.
I think we're seeing it play out in real time right now. I think some recent analyses are telling us that there are 70 countries that will see 1 in 10 of their population vaccinated by the end of 2021. We are seeing estimates that we're looking at until 2024 before the poorer countries of the world are able to achieve herd immunity, while other countries are talking in terms of quarters, quarter 3 versus quarter 2 in 2021. So yes, unequivocally, this is because we must elevate the voices of those who don't have the platform. We must continue the push to make sure that when we invest in addressing an issue like malaria, we are also improving primary health care for the most remote and underserved population. And because we haven't cared enough, we're still struggling with something we should have frankly figured out 30 years ago.
Right. Well, we're going to take a quick break, but we're going to have you stay on the line. Let's come back and continue this conversation in just a couple of minutes. Just stay tuned to consider this. Thank you so much for staying with Sharaad and I on Consider This. Let's continue our conversation with Dr. Sarthak. He's the CEO of the Asia Pacific Leaders Malaria Alliance. And we're talking about progress towards eliminating the mosquito-borne disease over the next decade. Sartak, let's talk about COVID-19 and this pandemic. How does this pandemic and, of course, the economic fallout that we've seen coming from the pandemic, how does that threaten long-term progress towards malaria elimination? Are we, has the goal of eliminating this disease in 10 years, has that been jeopardized by COVID?
It has been jeopardized in the near term. We were not able to, in many cases, make the progress that we may have made in 2020, whether we're talking about countries which were on the cusp of elimination, a near elimination country like Bhutan, for example, where we're also talking about countries as vast as India or a place like Papua New Guinea or Eastern Indonesia, parts of Indonesia, where the burden was extremely high and the simple focus was not able to be there. So that's a year that has challenged malaria programs for certain, as it has with many other infectious diseases. But I think the question becomes, how do we find very clear ways to communicate that investment in a vertical intervention, a set of interventions to complete the task of malaria elimination can be linked to strengthening health systems to deal with the next pandemic, to deal with improving economic output, and to also deal with the fact that we are going to need solutions that are based on the local context of these countries. They need to be tailor-made. We have to work together as a region and as a globe, but we also have to really put our money where our mouth is in terms of being able to build local capacity to manage these crises and to be able to finish the job in malaria. So yes, we've lost a lot of time and progress, but I am hopeful, certainly in our region, that we can quickly close that gap, because we're all starting to see some light at the end of the tunnel, and at the same time, investments in health will be on the minds of political leaders.
Right.
Sartak, you know, and often in our discussions we talk about medicine, we're fixated with medicines, we're fixated with vaccines, we talk about the other kind of strategies there are, but what about the question of the environment and a relationship of human populations to the environment? Does malaria tell us something about the way in which we make ourselves vulnerable when we engage in the environment in unsustainable ways, perhaps?
Yes. Thank you very much for pointing this out, because as we all know, the planet is heating up. That changes where we will find malaria, where we may not have found malaria before. It also changes the way in which the vector behaves due to shifts in climate change. We might see mosquitoes biting at different times of the day than they used to bite, which will then, of course, affect the kind of interventions that you'll have. So there's a geographic scope to where the impact of climate change is happening. There's a behavioral scope. As you rightly point out, we are all part and parcel of our own contribution to heating up the planet. And I think that when we think about something like malaria and public health writ large, what this is telling us is that we have to work with our colleagues who study climate science, who understand what these shifts look like in not just regions or countries, but at a subnational level, and tailor our approaches to those specific contexts. Right. In a cross-disciplinary way.
I'm very curious to know, because you brought up, you know, a kind of tailored approach to the fight against malaria, and I understand that a one-size-fits-all approach doesn't necessarily work when it comes to eliminating this disease. But can you be more specific? And how are you talking to governments so that they are empowered to have a tailored approach when it comes to dealing with malaria?
Yes. Thank you. It's an excellent question. When we're talking about tailored approaches, it's important to remember, as we talked about earlier, that malaria is in discrete pockets, and often those are places which are remote and rural, which are certainly far from a place like New Delhi or Port Moresby, Papua New Guinea, or Jakarta for that matter. And so in these health systems, which have in their own right recognized through their own governance structures that provincial level authorities and or district level authorities must be A, empowered, B, equipped with the capacity to look at data, analyze the vectors, or they have entomological capacity to understand what's happening with the various mosquitoes, and then be able to plan and manage their response. And so what we're doing is trying to elevate the voices at that subnational level in partnership with these governments at the central level to help surface the key pieces of evidence that they can contribute so that the necessary policy reforms can occur at a national level. That might mean we need this new innovation and we need it to go to place X. Or we need these resources and they need to be devoted to manpower or woman power Y. Those are the things that we have to do. It's not only about top-down, one-size-fits-all, it's also about an elevation of technical evidence, and that's work about building bridges, right, between what the technical experts know globally and even nationally, and supporting not just the political alliance of countries in the region, but within countries.
Okay. When you talk about these approaches, I'm just wondering, you know, we've had several years now of data and research about malaria. Have there been new innovations, Sartak, when it comes to fighting this disease? Are we equipped with new tools in the approach to fighting malaria?
I think there's a plethora of new tools. And again, when I'm answering a question like that to you, I have many colleagues and partners and friends across the world who are developing new tools, who have developed incredible tools, and are working to create the next generation of those tools. I think there's no lack of innovation.
Okay.
But in global health, it's the same problem over and over again. How do you link innovation to the delivery that's appropriate for a context and sustainable within a public system? And to do that, you know, a place like Malaysia can teach a lot to other countries in the region, as can a place like Sri Lanka. If you look at models of, say, managing district-level data or regional management of malaria programs, those are the kinds of things. I think the management part of this is for those particular pockets can't be underestimated in its importance. So I think there are lots of innovations, but let's remember, Sri Lanka eliminated malaria with pen and paper.
Wow.
Right? So it's great that we have these new tools, but let's use the things that work for the place in a way that they feel comfortable with and that they know will accelerate progress.
Wonderful. Thank you so much, Sartak, for joining us on the show tonight, helping shed light towards the fight against towards eliminating malaria. Thank you for your time. We really appreciate it.
Thank you so much for having me.
That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad, Kuttan, signing off for the evening.
Thank you so much for watching, and good night.